convince others. And therein lies danger sometimes, Such a person makes an enjoyable patient for the homeopath because he's impressionable and trusting. So I had a few patients of this kind. Like some people would be like, suppose they hear something about, they are religious and they like Ayurveda, homeopathy, and all those things, and so they are very excited sometimes about Baba Ramdev and others, and then they will say that, Ramdev has this particular oil. I may not approve it, but they would believe whatever that person is saying, and then they know how to convince others. They're very convincing when they speak about, like, okay, if you are from a scientific background, you may find it very difficult to accept some of the claims of Baba Ramdev and his Ayurvedic preparations. But still, some of your patients, if they are phosphorus, they would convince you. They would know how to convince you. They would just tell you, like, how wonderfully it has worked in other people, how wonderfully it is working for them. But still, they need treatment for the same problem. And now the thing is, they cannot see it. They think that it has worked, and it is working in some way for them. They are deeply impressionable and deeply trusting and enthusiastic about the thing that they think is true. If somebody else has convinced them without supportive facts, and once they are convinced, they are convincing to others. The phosphorus patient believes in what the prescriber tells him and follows directions willingly with effusive gratitude. Right from the first interview, the patient views the prescriber as a friend, shaking his hand warmly, sitting forward on the seat, and perhaps reaching out to touch the prescriber's hand or wrist when emphasizing a point. This patient gives symptoms freely without holding back. There is a predisposition toward anxieties of various types, but these are relieved easily by just a few reassuring words. And this is very common. If you are not able to distinguish between phosphorus and, say, arsenicum album, both are restless and anxious, the phosphorus patient would feel relief after you give them some positive feedback. After you say that, well, it seems like your condition is aggravated, but this is temporary. It will be followed by a long time of relief. And they would accept it, and they would feel relieved immediately. So you don't have to continue to repeat these things. If they have any suspicion or doubt, they would call you, and you just clear the doubt, and again they feel relieved. But arsenicum album is not like that. So arsenicum album, what happens is they would demand you. Like you said, there would be relief, and there is no relief. There would be relief. They would be feeling much relieved, but still they will say, I have no relief, because for them relief means it's completely gone. Then only they would say there is some relief, So this is a key point in distinguishing between arsenicum album and phosphorus. Phosphorus, if you give them a pat on the back, and if you give them a few positive words, they would feel that yes, relief is on the way, and they would be patiently waiting for the relief, and they would get some relief immediately, emotionally. But arsenicum would not get any relief emotionally. Even if you say, they would still demand relief. Nitric acid is also like that. They would be very unhappy if they don't get the desired relief soon. The diffusion of awareness is evident by the fact that the phosphorus patient is easily startled. All of us can relate to the state of mind of daydreaming. Awareness drifts to a far-off place or circumstances. During a daydream, if there is a sudden noise, like a blaring horn, a slamming door, or a burst of thunder, the daydreamer is startled because awareness is pulled suddenly and joltingly back into the immense reality. This is the state to which the phosphorus patient is highly susceptible. So the patient would be here talking with you, and suddenly they would go into some other state, and then when you invite them back into the conversation, they'll be startled like this, suddenly they are coming back to their senses, gathering themselves, or whatever you call it. It is a diffusion of awareness which the patient may not be able to control readily. During a thunderstorm, the normal person will hear a clap of thunder and then easily prepare himself for more. The phosphorus patient, however, tends to become diffuse automatically and so will be startled with each noise. So each time there is a thunder, the patient would feel startled. In the first stage of phosphorus pathology, the physical symptoms usually predominate. In the childish stage of development, whether 5 years or 35 years of age, there may be a tendency to easy hemorrhages. Nosebleeds occur with little provocation. Menses may be profuse and prolonged. The bleeding tends to be bright red in color. The bleeding tendency is symbolic of the general essence of phosphorus. What warmth and brightness the phosphorus patient possesses diffuses freely outward with little sense of barriers. It is at this stage that we see the phosphorus patient who is easily refreshed by sleep. This is understandable when we reflect that sleep is a time when the ordinary efforts to maintain immediate physical awareness is relaxed and rested. People who are more controlled and mentalized take a long time to achieve this rest. They must fall into a deep sleep. A phosphorus patient, on the other hand, is quickly refreshed because his awareness can diffuse in this manner very readily. During this stage, we also see the characteristic phosphorus thirst, particularly for cold drinks. If there happens to be burning in the stomach, the pains will be relieved by cold things, but this lasts only until the drink or food warms in the stomach. And then the stomach may again aggravate it. There is a typical craving for chocolate and sweets. Considering the thirst and the craving for sweets, it is easy to see the phosphorus predilection for diabetes. As the physical pathology progresses further, which is the second stage, the process of hemorrhage may be evident on deeper levels. There may be painless hemorrhage from the gastrointestinal tract, resulting in an unexpected hematemesis or melena. There may be bronchitis in an early and mild phase, yet with hemoptysis of bright red blood. There may be hematuria unaccompanied by any other symptoms. Laboratory tests and x-rays may be done and nothing found. In these circumstances, think of phosphorus as a possible remedy. While the physical symptoms predominate, there are few symptoms in the emotional or mental spheres. As the pathology progresses, however, into the second stage, we see a subsistence of the physical symptoms as an increase in anxieties and fears. Of course, there is a true anxiety for the welfare of another, whether friend or stranger. It can be carried to a pathological degree of anxiety, dissipating even the energy of the patient himself. This is the true state of sympathy, whereas other remedies in the same rubric are anxious about others out of a primary motive of self-concern. There is a strong anxiety about health in phosphorus. The patient becomes so suggestible that even if he hears of someone else with a particular illness, he will be concerned about the possibility that he also might have that illness. This vulnerability to suggestion, however, is easily assuaged by counter-suggestion, a few reassuring words by the homeopath, and the patient sighs with relief and is profusely thankful, only to come back when he hears another alarming possibility. So the anxiety about health is generally about cancer or some deep-seated affection to which phosphorus patients are usually susceptible. And now here we have, they would read somewhere in the newspaper that, okay, this bleeding and all those things may indicate rectal cancer or something like that, and they would come and you would have to assure them that it's not rectal cancer, you don't need to worry, you can do these tests, and then if it is just a case of some hemorrhoids or maybe even just an irritable bowel syndrome, you give them some assuring words and they would be fine. But it is during this stage that there is an emergence of many fears. There is fear of the dark, fear of being alone, fear at twilight. There may be fear of thunderstorms. At first, these anxieties and fears are fairly mild and still corroborated by thirst and a refreshed sleep. So when Vithoulkas describes it, he says that in the first stage, the phosphorus patient is generally refreshed by sleep, is diffusing, and always You need to bring them back from their daydreaming tendency, and they may have some burnings in the stomach and other places which are relieved by cold drinks, and they may crave chocolate, sweets, and salt, which we talked about before. But in the second stage, there will be increase in anxieties and fears, anxiety about other people's health, anxiety about their own health, anxiety, and it would go into fear of being alone, fear in the evening, fear of thunderstorms, and still alongside there would be thirst and refreshed sleep, so that you would be able to distinguish it from other medicines. So if the combination of the patient being chilly and desiring cold drinks and not able to tolerate cold drinks, desires cold food like ice cream, which he can tolerate, and then the refreshed sleep, if these symptoms are present, then you would generally think about phosphorus with all these fears